So health workers fighting Ebola in the Democratic Republic of Congo are facing renewed threats of violent attacks that could threaten their work. Some NGOs have been forced to close and some health workers have been forced to relocate. Our Debora Patta visited the country and spoke with some of the people who are still on the front lines fighting this disease.
They may not look like an army, but these men and women are the thin front line of the war against Ebola. Armed only with thermometers, they wield their weapons from door to door, checking the daily temperatures of those who've come into contact with Ebola patients. It looks innocuous, but it's dangerous work.
People have lost their lives. What makes you so courageous and brave?
No, I'm not afraid. I want to do this, Bahati Ozanda says, because these are my people. Just the day before, 2 villagers were diagnosed with the virus.
The most recent cases of Ebola were found in this house. You can still see the ashes of the mattresses and utensils that had to be burnt in order to decontaminate the place.
Within 24 hours, a makeshift clinic had been set up, providing free vaccines to anyone at risk. It's crucial to set up a ring of immunity by vaccinating as many people as possible, says the World Health Organization's Dr. Margaret Harris.
It's a great tool, but it's not the magic bullet, because the vaccine is only as good as finding all the people who've been in contact with somebody.
And getting the sick to treatment centres quickly is not easy in a war zone. Although a civil war officially ended here in 2003, fighting among rebel groups continues to this day.
The road from Dekatu to Mangina is treacherous. Not only is it in a shocking condition, but there are a lot of militia groups along the route.
And then there are the hasty burials. The body of someone who has died from the virus is highly contagious for at least a week after death. Burial teams must wear protective gear. Graves have to be twice as deep as that of a standard burial, and families are kept at a safe distance. So protecting those left behind is critical, as the victims of this deadly disease can become Ebola's cruelest weapon. Debora Patta, CBS News, Bekatu, Democratic Republic of Congo.